Hi, everyone. I'm going to give you your breakdown of clinical week 2 assignments. So same formatting as last week. You will have until Saturday evening to finish these case studies. So on May 2nd at 9 p.m. is when these will be due. We're going to mix things up a little bit. This week, I'm pretty excited about. There's a software program where it simulates as real life as we can get medication passes, those types of things, taking care of patients. So we're going to use that this week to kind of give you another experience um, to be as holistic as we can. So when you are in Brightspace, under the clinical tab on the left-hand side, I already have it pulled up. You've been here before, but at the top there's a Word document for clinicals for week 2. So that's what I'm going to refer to. So make sure you click in. I would print it off or just make a checklist out of it and just check things off one by one as you're going through to make sure that you have everything completed. The other two worksheets that you'll need to reference this week are clinical decision-making worksheets that you'll be doing for patients, and then also critical thinking med administration worksheets that you'll be doing on medications that you're giving. So these are kind of the 3 documents that you'll need out of Brightspace to refer back to and work on. All right, so I'm going to click up here. The first thing that you're going to need to do if we're walking through the worksheet for clinical week 2 is you're going to have to set up an online account for, it's kind of a simulated hospital called Swift River, and it's pretty neat. So the first thing you're going to do, the address is on the page where you're going to type in, and you're going to come to this screen, and the first thing you're going to do is create an account. Follow the prompts. It's very simple. Use your email as your username, create a password, and then there's an access code that is on this clinical week 2 worksheet. And when it asks you for that access code, you're going to put that in, and then that's all you're going to need to do. Just make sure that you remember your login. So write down your username and password, and you're good to go. So I'm going to just let you do that establishing your account step, because it is pretty straightforward. So I'm going to put my password in here, and then I'll show you what everything looks like. So once you log in, where you're primarily going to be working off of is on this left-hand side where it says student dashboard. It says practice. So I'll kind of walk you through step by step. A couple things to remember in the student information section. When you are working in an area, there'll be a pause button on the screen. Make sure you use that pause button if you need to stop and come back, so that you can start off in a simulated setting where you were. Okay, so make sure you use the pause button. Try to envision that you are taking care of these clients in real life. So they do a really nice job making this as real life as possible. So take advantage of that and enjoy it, and picture yourself in this real life setting. Make sure you have your drug guide available. And also, to make it real life, you will get interrupted. So you may be working with a patient and someone comes into the room with a question, or your CNA comes into the room and needs help, or all kinds of disruptions, which is really neat because that's real life as well. So just don't get frustrated with that, and instead think about that's what's going to happen when you're out in practice. So there are 4 assignments that you're going to do, and I'm going to kind of just show you where you're going to find everything, because the worksheet is very self-explanatory as far as what you need to do for each patient. So let me just orientate you a little bit here. So we're going to use this practice button. I'm on the left-hand side. And once you click on practice, you'll notice you have these 8 different box options. So for the first assignment, you will be working in dosage calculation. And in dosage calculation, there's some tips that are listed on the worksheet, and then you are going to give certain patients certain medications. So the first one Anita and the medication that she will be receiving. And you'll start that scenario, you'll complete that. And then you're going to give her a second medication. So you'll select that. I apologize because it's up by my Zoom top, but you'll select that second medication you're going to give. So you're going to kind of walk through right off your worksheet, find the patient, find the med, click on it, start the scenario, and then complete all of those. Okay, so that's dosage calculation. The second assignment is going to be found, I'm going to go back to practice, in the math refresher. So in the math refresher box, you're going to type 20 problems. And then under types of problems, you're going to check all of the boxes except for IV. Okay, so you're going to check all the boxes except for IV. And then start practice. So you'll do these math problems. Okay, here's that pause button we were referring to that you need to use up in the upper right hand corner. So I'm going to go back. So that's the first piece. And then the second piece is you're going to go back to MedBox. Or excuse me, the math refresher. Hold on one second. All right. The math refresher is the 20 questions. Sorry, we're on number 3. On number 3 on the back page of your clinical assignment, you're going to go to the MedPass box. Okay, back to the MedPass box. And for this one, you're going to complete a MedPass on the following patients. So remember in the first activity, it had you the patient's name and then the specific med. Now you're going to do just selecting the patient, and then you'll work within that so you don't pick out the med specifically. So there's 3 patients, Anita, Bonita, and Shirley, that you'll be working on, and that's right on your worksheet. You're going to complete 2 critical thinking med sheets for each patient. For all other medications given, complete the medication summary sheet. And I'll pull that up in Brightspace, so that's up there for you as well. Next, we're going to go back to practice. Click on the Med-Surg box. You're going to select your specific patient, and Ann Rails and John Duncan are the 2 patients that you're going to do, and you're going to do a full clinical decision-making worksheet on them. So that normal clinical decision-making worksheet that you would do in the clinical setting, you'll be doing on these 2 patients. On the bottom of the back of the second page, there are 5 things that you'll be turning into the Dropbox by Saturday night. And that is a screenshot of your score report when you've completed all assignments. So you can go on the left-hand side here where it says score report, and you can choose your dates. Let's say you worked on it throughout the week. You put a start date and end date in there and go. And then we'll see that. So a screenshot of that. So you can either screenshot on your computer and save it. You can take a picture and upload that, however you need to get that into the Dropbox. You'll have a total of 6 critical thinking medication sheets, 3 medication summary sheets, 1 for each patient for those medications that you're completing it as a summary, 2 clinical decision-making worksheets, and those are those last 2 patients, Ann Rails and John Duncan, and then 1 journal entry. And that journal entry is your reflection. So it's going to be 1 page typed, and you're going to describe how did this week of clinicals go for you? What did you learn? Compared to last week's clinical assignments, what were the pros and cons of each type of clinical experience? All right, so the nice thing about this week's assignment is I really feel like you can take your time, do one section out of these 4 big sections that you're going to do. Do one section, complete it, and then the next day do another section so that you're not overwhelmed and you can really enjoy the experience. And just remember, if you have to stop when you're in the middle, you can hit that pause button, and then you should be able to come back and log right in and pick up where you left off. If you have questions, please let Debbie and I know. And we really look forward to you working in this environment this week. I think you'll enjoy it. All right, thank you.